The storing and voiding of urine is a cycle which is repeated many thousands of times, from the first wet nappy of a baby to the cessation of all vital functions, only drawing attention to itself when a fateful development disturbs the harmony of structure and function. An exact knowledge of the anatomy and the physiology of the lower urinary tract is essential for the treatment of the subsequent urological dysfunction.
He who is most amazed at the fact that the much discussed question has become again object of the anatomic inquiry is asked to read the specialist literature on anatomy and physiology of the urinary bladder, and in that case he will be surprised, and rightly so.
The proposed three-dimensional model of the anatomy of the distal urinary tract is based exclusively on our own histomorphological studies. For the first time, the organs of the lower urinary tract of both genders and all age groups were analyzed. In this way, anatomic findings have been obtained from 30,000 histomorphological serial autopsies. At present, it is generally agreed that a fundamental condition for urinary continence is the extent to which the maximum bladder capacity is limited by the elastic potential of the detrusor. In general, the musculus sphincter urethrae is considered to be the main factor for the urinary continence. This, however, raises the question how a supposedly striated and therefore voluntarily innervated muscle is able to ensure a continuous continence. Despite different detailed morphological studies, the majority of researchers interpret the musculus sphincter urethrae as part of the muscle system of the pelvic floor. It is considered to consist partly or fully of strands of the so-called musculus transversus perinae profundus. The muscle is described as being located between the prostrate and the crus of the penis and embracing the Cowper's glands dorsally. The musculus transversus perinae profundus will now be shown in the diagram. This muscle should be visible in a series of histological cross-sections from the seminal caulicle down to the bulb of the penis. The first picture shows the prostrate at the level of the seminal caulicle. The symphysis can be found in the center of the preparation. Furthermore, the musculus levator ani and the musculus obturatorius internus is visible on both sides. The following histological pictures show clearly that the external sphincter is separated from the surrounding muscles of the pelvic floor by the connective tissues shown in green. Again, only the musculus levator ani and the musculus obturatorius internus can be found in the lateral direction, but no musculus transversus perinae profundus. The next picture shows the same situation. The musculus sphincter urethrae is surrounded by connective tissue. Cowper's glands can be seen clearly in this transverse section. They are embedded in connective tissue. The final section already shows the bulb of the penis. Obviously, the musculus sphincter urethrae is completely independent of the surrounding muscles of the pelvic floor. A musculus transversus perinae profundus as the main element of the diaphragma urogenitale does not exist. Now, which muscular structure does actually ensure the occlusive function of the bladder? Our investigations proved that the lumen of the urethra is surrounded by a circular smooth sphincter muscle located directly in the bladder outlet. This so-called internal sphincter, or musculus sphincter versace, is the only muscular system to occlude the internal urethral orifice. The musculus sphincter versace is described by numerous authors as a base plate which ventrally consists of bladder muscles and dorsally of trigonal muscles. It has been suggested that the occlusive system of the internal sphincter is formed by a special loop system of the detrusor lamellus. The computer animation explains how it came to these erroneous assumptions. Indeed, in a strong traversal section plane, the internal sphincter appears as a structure consisting ventrally of bladder and dorsally of trigonal musculature. if one cuts a section following the physiological curvature of the organ, then the muscular sphincter verticae is clearly defined as a ring-shaped muscle directly in the bladder outlet. Lamellas of the bladder musculature are not involved in the formation of this muscle. The caudal part of the muscular sphincter verticae is strongly pervaded with prostrate glands, especially in elderly men. The smooth muscular internal sphincter can be destroyed during surgical procedures at the bladder neck, partly intentionally, partly unintentionally. But all these patients remain continent. How does this correspond to the common theory assigning the main functionality of urinary continence to just this smooth muscular internal sphincter? We will now focus on the so-called external sphincter. As proved in our histomorphological studies, the muscular sphincter urethrae exists independently of the muscles of the pelvic floor. Furthermore, it can be shown that in the female as well as in the male, a smooth muscular part of this muscle exists. In order to distinguish both parts of this muscle, the terms muscular sphincter urethrae glaber for the smooth muscular part and muscular sphincter urethrae transverso striatus for the striated part are introduced. This frontal section shows clearly the two components of the external sphincter. The asterisks indicate the smooth muscular part, the dots indicate the striated part. Laterally, the connective tissue shown in green and the muscle levator ani. The muscle fibers of the muscular sphincter urethrae transverso striatus form a ring-shaped structure around the urethra that is open dorsally, thus producing a horseshoe shape in the transversal plane. Again, the two parts of the muscular sphincter urethrae can be distinguished. The same situation can be found in the female. From a functional point of view, the muscular sphincter urethrae transverso striatus as a striated, voluntarily innervated muscle could avoid stress incontinence. The muscular sphincter urethrae glaber as a strongly developed smooth muscle, involuntarily innervated, has the morphological conditions to act as the really decisive long-term continence maintaining unit. The function of the muscular sphincter verticae will be explained in later research. We will now focus on another muscle system, the longitudinal muscle system of the urethra. In all autopsy material, a ventral longitudinal urethral muscle system was always evident in the male as well as in the female. Furthermore, in the male, a strongly developed dorsal longitudinal urethral muscle could be detected. Next, we will deal with the ventral longitudinal urethral muscle system. These muscle cell bundles originate in the lower part of the symphysis and run in the direction of the bladder outlet. They cross the muscular sphincter verticae in steps. While still in front of the internal urethral orifice, the muscle cell bundles turn in the caudal direction and run in immediate vicinity of the urethral lumen down to the bulb of the penis, or alternatively, the bulb of the vestibuli. Due to its special course, this muscle system is the only structure capable of actively initiating micturition by opening the bladder neck by a contraction-induced movement in caudal and in ventral direction. We have therefore named this structure musculus dilator urethrae. In addition, a strongly developed dorsal longitudinal urethral muscle system can be found in the male. The muscles of both seminal ducts join directly at the level of the seminal caudicle and run as a strongly developed muscle bundle in caudal direction to the bulb of the penis. This can be seen clearly in the frontal section. The dorsal longitudinal muscle system can also be seen as a well-defined structure in the sagittal section. This muscle generates a fold within the urethra, the so-called crista urethralis inferior. Considering the close connection of this muscle system to the ductuli ejaculatori, it is very likely that a contraction of the dorsal longitudinal urethral muscle system is responsible for the seminal emission and ejaculation. For this structure, we have therefore additionally introduced the description musculus ejaculatorius. As for the functionality of the musculus sphincter versicae, shown in green, we conclude the following. A contraction of this muscle closes the bladder during the ejaculation, and so separates the urinary from the seminal tract, thereby avoiding a retrograde ejaculation. Both the longitudinal muscle systems are located in the immediate vicinity of the lumen of the urethra. The scheme is now completed by the two parts of the musculus sphincter urethrae. Now displayed is the complete and very complex anatomy of the lower urinary tract in the male. Apart from the musculus ejaculatorius, all these anatomical structures are also found in the female.